It's my feel-good breakfast show.
Welcome back to your Tuesday morning. This is your feel-good breakfast show, Expresso on SABC3. Now, diabetes is in the top 10 leading causes of death worldwide, and today we observe World Diabetes Day, and this year is focused on women and diabetes because 199 million women worldwide suffer from the disease, and it's been estimated that by 2024 that number will rise to an extraordinary 313 million.
And we're joined this morning by Dr. Darren Green, along with one of Cape Town's top physicians and experts in diabetes, Dr. Marius Wasserfall. Good morning.
Good morning.
Dr. Green, good morning to you too.
Great morning to you.
Welcome to the show. Great to have you guys here. So let's start off with you, Dr. Wasserfall. Tell us about the main factors that are contributing towards this rapid rise. We're talking 313 million by 2024.
Massive. As you mentioned, the big problem in the world is that deaths are mainly driven by heart attacks and strokes. That is the number one and number two causes of death in the world currently. Those are predominantly driven by, amongst others, diabetes. And if you look at the obesity pandemic over the world, people are getting overweight sooner and more overweight. That is leading to diabetes, and diabetes is then driving heart attacks and strokes, amongst other complications. If you look in South Africa, we've probably got about 9.5% of people that are diabetic, and 45%, half of them, are not even diagnosed. We are missing the diagnosis, and people are presenting with complications because of that. If you look at predicted numbers, we are expecting diabetes to increase by 140% by the year 2040. So if we already got a problem that's driving heart attacks and strokes, which are the number one and two causes of death, imagine what we're going to be sitting with by the year 2040.
Those statistics are very, very scary.
Yeah,
but I need to know, what's the best way to most accurately diagnose type 2 diabetes?
You can basically go to your doctor. If you are sick for whatever reason, they can do a spot finger prick glucose reading to see. But there are actually 4 ways that you can test it, because all of them have got their own problems. So you can either do your fasting sugar test in the morning, so it's a finger prick in the morning with a fasting value above 7, or during the course of the day if the value is above 11. But then what we usually try and do these days is you've got a 3-month average test, where the blood kind of remembers your sugar reading for the past 3 months. So we can do a single blood test at a lab that has been accredited, and that can be used for diagnosis. And the 4th way is actually to go for a sugar challenge test to see how the body copes with a glucose load and how your glucose metabolism works. So those are the 4 ways. It's important to know that if you present with symptoms, you can use any one of those at any given time. But if you are asymptomatic, you need to repeat the tests 2 weeks apart to make the diagnosis.
Yeah. Okay. We talk about symptoms and the things to look out for, and the 3 Ps comes to mind, Dr. Darren. What are the 3 Ps?
Yeah, that's an
and
easy
how
way.
can they be
An
used
easy
to?
way of us remembering some of the symptoms. So polyuria, you wee a lot. So you get up, and you've got nocturia. You get up a lot at night time, particularly because of the high sugar levels and also the high content of glucose in the urine.
Okay.
Then polyphagia, you eat and you don't get full. Some people have that problem. And then polydipsia is the other one, where you're thirsty, you're constantly thirsty. But a lot of people complain of sudden weight change. They also complain of visual disturbance, where you have blurry vision and low energy dips during the day. And that's obviously because of the blood sugar fluctuating and your body's inability to regulate it via insulin, or the pre-runner of diabetes, which is called insulin resistance. So we find that those are the predominant features that give you a warning.
All right.
Okay.
Well, we're going to keep our lines open on 0214309881 to learn more about diabetes, as today is World Diabetes Day. And when we come back, I want to find out about the polyuria you were talking about, because, I mean, I drink a lot of water, but then as a result, I wee a lot. So am I in danger? Okay, we'll find out about that very shortly. Stick around.
It's my feel-good breakfast show.
So with alarming statistics that by the year 2040, there will be 313 million people with diabetes worldwide. We are facing a very, very big crisis right now. In fact, I think Richard wants to weigh in on the conversation. He's calling us from Cape Town. Good morning, Richard.
Good morning to you. Morning to the studio audience.
Thank you so much for calling. What is your question or comment?
I just want to know, we are on holiday now. I just want to know, my wife has needles at home. Now, is it a transmiss? Because you can't inject her now.
All right, so that is a question from Richard there. Seems that a bit of packing dilemma there. So how bad is it?
So he's speaking about the insulin needles. The
I would
one
assume
that,
so.
yeah. So to inject, obviously, your insulin So assuming it's either a poorly controlled type 2 diabetic or a type 1 diabetic, she would need to get needles as soon as possible. Yes, it is a train smash. I mean, she is dependent on that insulin to regulate her sugar levels, as a body can't do it on her own. What she can do in the meantime is obviously be meticulous about her diet as well.
Yeah.
But even despite doing that, she's going to need definitely to be back on a chronic medication.
Definitely. Plus, all pharmacies in the country stock needles. It should be very easy just to go to the closest pharmacy and buy a few needles for insulin injections. That shouldn't be a problem.
Excellent. Richard, thanks for the call. Please do take the necessary precautions. Leading on from that, people tend to think that type 2 diabetes is a condition that's only developed by older people who happen to be obese. Is that always the case?
No, well, we actually see an emergence of diabetes, type 2 diabetes, even in younger people under the age of 20 now.
Sure.
Obviously, with the classification of diabetes, we all know insulin-dependent, non-insulin dependent,
Yes.
but there's a lot more to it than that. And I'm sure, I mean, in your practice as well.
Yeah, we are seeing it in daily practice. The fact that people are getting overweight a lot earlier in their lives is leading to people being diagnosed with diabetes a lot earlier. So where the common age people think about 50 or 60 or 70 has now really dropped. And I see a lot of people in my practice that are between 25, 35 to 40 years old that are diagnosed type 2 diabetics who've been overweight for 10, 15 years prior to that. So it's really a pandemic driven by obesity, and we are seeing younger and younger people not just diagnosed with type 1, but really with type 2.
Okay. Well, I wanted to know, this year's campaign is focusing on women and diabetes, and I wanted to know, for someone that's perhaps pregnant and they get diabetes while pregnant, what are some of the risks that can occur?
You can divide those risks up between risks for the mother and risks for the baby. So the risks for the baby is basically if they are constantly exposed to a high blood sugar level, because the mother's sugar is high, that crosses the placenta, baby is exposed to high sugar levels, which means baby's pancreas makes more insulin. Combination of those leads to more growth, so bigger babies, and that then leads to increased incidence of cesarean sections, but also those babies do tend to have more difficult delivery, so they can get stuck in the birth canals, they can have to be born earlier. In other words, before their lungs are fully developed, so they can have lung problems, etc. So for the baby, there are all kinds of problems. And for the baby, it then also means that they've got an increased risk of diabetes later in life. For the mother, during pregnancy, they are more likely to develop hypertension, as well as a condition called preeclampsia, which can actually be life-threatening both for baby and for mom. And even if the gestational diabetes then reverses after pregnancy, the mother that developed a gestational diabetes still has a 50% chance of developing type 2 diabetes within the next 5 to 10 years.
My word.
After the pregnancy,
Wow. Yeah. Well, a wealth of knowledge here from our good doctors, Dr. Wasserfall and Dr. Green, and we'll keep our lines open. I'm sure you have many questions to ask. That number to dial is 0214309881 as we observe World Diabetes Day.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show. It's Expresso, and as we observe World Diabetes Day, we are joined by Dr. Darren Green and Dr. Marius Wasserfall, and we've currently got a caller on the line, Joycelyn from Cape Town. Good morning.
Morning, family. Good morning. I'm Jocelyn.
Jocelyn,
Good morning.
good
I love that you call us family, because we are.
What's your comment or question for Dr. Darren Green or Dr. Wasserfall?
Yes, I suffered an aneurysm in July. I am a type 2 diabetic. I'm 60 years old. I was currently, before the aneurysm, I was on metformin 500, which made me very, very sick. After I was being discharged from the hospital, my eye closed up of the aneurysm, and the doctor said it wouldn't open up again, but it did open by the grace of God. Long story short, I was discharged on metformin 850, which makes me extremely hungry, Dr. Green. People think I'm greedy.
So a lot of the GIT side effects associated with the oral diabetic treatments that you mentioned, they affect obviously your tummy. A lot of them are associated obviously with things like even diarrhea and gastric irritation. When it comes to hunger, one must always beg the question, is it due to polyphagia, that she's actually hungry? As I mentioned earlier on, you eat and you don't get full, which is a symptom of diabetes itself, not necessarily linked to the medication as well. I don't know if you want to add anything to the...
I think it's important to realize that metformin by itself cannot really drop your sugars down too low. If you are taking other medication that drops your sugars down too low, that then leads to you being hungry because your body wants to lift your sugar levels back up. So people often try and avoid sugars that are too low by what we call defensive eating. So once they start feeling their sugars dropping, they actually eat more. So metformin has got some side effects, but it's a brilliant, brilliant tablet that most type 2 diabetics really should be on, and try and work around that if possible. And obviously try not to eat more and then gain weight.
All right, Jocelyn, thank you so much for that call. We hope that was an insightful answer for you.
That was. Well, can I quickly touch on, just before the ad break, Dr. Wasserfall, you said that, you know, women that had gestational diabetes later on have a 50% chance of developing type 2 diabetes. Well, how are the ways they can prevent being part of that statistic?
Like with type 2 diabetes, the most important thing is really lifestyle change. So your 50% risk can be reduced to 25% risk if you can actually achieve an ideal body weight after your pregnancy. That is the most important. We also often advocate patients that have had gestational diabetes to stay on a tablet that's called metformin, like Jocelyn just spoke about, long term, because of the risk and the benefits that a tablet like that would have. But the best answer to that is actually to adjust your lifestyle, to eat a lower calorie diet, to exercise more, and to try and achieve an ideal body weight.
All right. Let's talk about a new area of study and development in regarding type 3 diabetes. What is that all about? I mean, the types just keep increasing now.
Yeah. If you look at the normal classification, we speak about type 1 and type 2. More than 90% of diabetics are actually type 2. That's your, let's call it your more adult type, where type 1 is usually the younger patients that do not have any pancreatic function and they need insulin. Then you have gestational diabetes, and if you've got your other types, for example, if I have to take out your pancreas for whatever reason may be, you're going to be diabetic. If you take in too much cortisone, if you've got a few other genetic abnormalities, so those are in the other types that one can have. Type 3 diabetes really has been a topic of discussion the past few years, where they have found that Alzheimer's disease is really got to do with insulin and glucose metabolism in the brain. So it's been suggested that Alzheimer's disease could be a type 3 diabetes that is only restricted to the brain. In other words, you've got abnormal glucose metabolism in the brain, and we know that the brain is really dependent on glucose for functioning. So if you've got high sugars in the brain, leads to inflammation, inflammation leads to deposition of proteins, and those proteins can then lead to Alzheimer's disease. However, we know that it takes 7 to 10 years before your sugar readings in the blood elevate enough that we actually call you diabetic. But within those 7 to 10 years, while you are losing pancreatic function, you can already start to develop various of the complications that are connected to diabetes. So we do not really accept the type 3 at this stage as a type by itself, but more a spectrum of the other types of diabetes.
All right. Listen, there's a lot for us to tap into. We have one more segment to go, and we're going to keep those lines open. 0214309881. Give us a call.
It's my Feel Good Breakfast Show.
All right, we're back again with Dr. Wasserfall and Dr. Green. We are talking all about World Diabetes Day, which we observe today. And earlier on, we were talking about gestational diabetes that's developed by mothers during pregnancy. And Dr. Wasserfall just wanted to shed some light, just to kind of wrap up that side of the conversation.
I think it's just important to know that although diabetes has got its own problems, especially in pregnancy, most mothers with gestational diabetes will deliver normal, healthy babies. So although you have to watch for the complications, hopefully, if you're going to be watched by your gynecologist, everything should be well.
All right. Now, let's talk about the exciting medication that's now being developed for usage against type 2 diabetes. What's happening there?
Basically, for the past 30 years or so, the tablets that we've had, we've noticed that they are not really effective against the biggest problem in diabetes, which really is heart attacks and strokes. So most of those tablets have been working on the pancreas as well as on insulin metabolism, either getting your body to produce more insulin or secrete more insulin, or then to get your body to utilize the insulin that you've got available, or then you inject insulin, etc. The new exciting class of medication actually works on your kidneys, which has got nothing to do with insulin metabolism by itself. Your kidneys, generally speaking, always keep sugar back. So whatever you are filtrating in your blood through your kidneys, it actually reabsorbs and it holds onto that sugar. The new tablet will allow your kidneys to lose some of the sugar. So you will be losing glucose in your urine every time you go to the bathroom. And it's a significant amount. You're looking at about the volume of 1 can of Coke, both in volume as well as sugar content that you lose every single day.
That's 10 teaspoons of sugar, by the way.
That's 10 teaspoons. So that is significant. And obviously, if you're losing that amount of sugar, you're also losing approximately 280 to 300 calories, which in diabetics then translate to weight loss. Awesome. And it's a tablet, not an injection. And it's very exciting because these tablets have actually showed a decrease in risk of heart attacks. So we are very excited about this tablet that's coming, and it's probably going to be catapulted up the guidelines where we use various medications and be used a lot earlier, especially in people who have got established cardiovascular disease.
So is this tablet mainly effective for those with diabetes?
It is, unfortunately, at this stage only effective for those with diabetes because your sugar levels have to be high for this tablet to work.
Okay.
So it will not be able to be used as a weight loss drug, and people who are not diabetic will not benefit anything from this tablet. But if you are diabetic, then your doctor should consider this tablet in specific situations because there are a lot of benefits associated with it. And as we said, you know, it's not insulin, it's not an injectable, so we're sure that patients will also be very happy to use it.
Yeah. Finally, are there any traditional methods of treatment that have been shown to be effective in the treatment of diabetes, especially given the rise in incidence now? You kind of gather that people will go to all kinds of lengths to try and treat themselves.
I think, accepting the fate that they need to have a lifelong commitment to treating diabetes is right at the top of the list. So taking your oral medication in this case is important, but we've shown that the benefits of combining lifestyle modification as well as medication is almost 3 times more effective than just medication alone.
Yeah.
And that's what we need to focus on.
All right. Well, doctors, thank you so much. Today has been so super insightful. I've got a lot to take home to Mom. We need to have a serious discussion, Mom. And we hope to see you again soon. Dr. Wasserfall, I know that you'll be on RSG tomorrow morning speaking about all things diabetes.
Specifically the new medication.
Excellent stuff. Well, thank you for joining us, Dr. Green. Thank you for joining us. And thanks to our callers as well for engaging in the conversation. We'll be doing this again next week.